For all verified facts, subscribe to our YouTube channel and click the bell icon to get the latest updates.
Hello and welcome. The COVID-19 pandemic has devastated lives, particularly the poor and disadvantaged across the world. But at the same time, it's also highlighted the inequalities that were already there in the systems or in the economies around the world. The wealth of Indian billionaires increased by 35% during the lockdown that we saw in 2020 and by 90% since 2009 to almost $422 billion. That's close to $500 billion, ranking India sixth in the world. They are, of course, following the global trend where billionaires are becoming richer. Jeff Bezos, Elon Musk, other tech giants, either companies or their founders saw their wealth increase dramatically in this period. So the question is, as these inequalities have increased and it's being manifested itself in either people losing jobs, losing their ability to access healthcare, children dropping out of schools, not being able to afford digital devices to even attend online school. What can be done about it? The Oxfam, an organization which focuses on restoring, rather ending discrimination and creating a free and just society, has been putting out reports which highlight these inequalities, not just in India, but across the world for many years. So the organization is also suggesting a whole bunch of steps to try and restore equality in the system. So let's understand this a little better from the inequality virus, the Davos India Supplement 2021. And to discuss this, I'm joined by the CEO of Oxfam India, Amitabh Behar. Amitabh, thank you very much for joining us.
Thank you.
Right. So, Amitabh, I think I've covered most of the key salient points, that there is rising inequality, and that was happening even before, but the lockdown and the COVID-19 pandemic as a whole has accentuated it. Now, this inequality has to be reset in some ways to at least bring those who've been severely disadvantaged by the pandemic to some level of normalcy. So how are you viewing this phenomenon and what needs to be done about it?
So, as you said, inequality is growing, and you've kind of given the startling figures. But let me just add a couple of revealing figures, which will paint a more vivid picture for everybody. So, in India, the top 11 billionaires during the pandemic added enough wealth to their kitty, which was good enough to sustain the NREGA for 10 years or the health ministry for 10 years. So that's the level of wealth our billionaires have added. These are the top 11 billionaires. Globally also, as you said, the picture is very similar. The top 10 billionaires in the world have actually added $500 billion to their wealth during the pandemic. But one important figure, maybe, let me add two pieces of further analysis to what you've already shared from our report. One is, I think, the stark difference between the ability of people to recover. So if you take the top 1,000 billionaires of the world, they did take a hit initially, but within 9 months, they've recovered and they're back to pre-pandemic levels of wealth. Whereas most of the studies, and including a recent World Bank study, tells us that poor ordinary citizens will take at least a decade to come back to pre-pandemic levels. So, this differential of people's ability to recover from the pandemic is also a very, very important factor that we need to bring into our analysis. And the second key point that I would like to add is that unfortunately and intuitively with our research, we know that inequality also has a gender dimension. It also has a caste dimension and a race dimension to it. Again, let me just give you a figure from the US. It's a depressing figure. It clearly tells us that we would have had 22,000 fewer deaths amongst the Black and Hispanic community if their mortality rate was the same during pandemic as their white counterparts.
Right.
So 22,000 fewer deaths. And you will similarly see in India also how there is a gender dimension. So, these are the two very important elements that I would like to add to this story. The obscene inequality that we are seeing all around us. And as you said, it's actually been growing. It's got really accentuated during the pandemic, but it's been growing for a while.
Right. And Amitabh, the method of equalizing that you're suggesting largely is a redistribution of that wealth, and I'll come to that in a moment. And just to the other point that you've mentioned in your report is that obviously our gross tax revenues have dropped, and our nominal GDP in 2021 is likely to be the same as 1920. And we've only achieved 42% of our tax targets, and that's an important figure to keep in mind. So the suggestions that you have outlined, Amitabh, and I'll come to that in a second, are also in largely fiscal and monetary. Would that be correct?
So I would say we are suggesting a whole range of actions, and inequality needs to be brought in as the fulcrum of the recovery plan post COVID. And I think that's very, very critical. And as you would see, we are also constantly talking about looking at education and health, essential services as drivers of equality. So it's going to be a whole range of interventions, but we need to make that fundamental shift in the way we look at how we do our fiscal monetary policies, but also developmental planning. And I would say it's a fundamental shift of a framework where inequality is one of the central questions. And I'll just say that, just look at, say, New Zealand, which in its budget now formally has started saying that we'll do a well-being budget. So we need a shift of something of real fundamental nature.
Right. Okay. Now, let me pick on two of the points that you've mentioned for raising those resources. One is you've said that we should be taxing those billionaires for the incremental wealth they've gained. The only the hitch with that is that this is unrealized wealth in some ways. This is really an increase in the value of their assets held in stock markets. So is that a feasible thing? The second is you've also talked about an additional surcharge of 2% above 50 lakhs. Now, I know that a lot of people maybe in government, in bureaucracy, would be completely aligned with this, but it may not be so aligned with those who are already paying high taxes, including surcharges, particularly at this level.
Sure. So again, Govind, let me say that if we do this, we are not going to be unique. It's not going to be the first country which has done this. Argentina has already introduced it. And it is important to, I'm told I've been doing work with governments. Very often governments learn from other governments. So if Argentina could do it, why not India? These are unprecedented times, and you do need unprecedented actions. And they have a surcharge on the super rich for COVID. I think it's doable. The larger question that I think we need to address is, without getting into a quibble about whether it should be 50 lakhs or 60 lakhs or 55 lakhs, what we are essentially saying is that this inequality is unacceptable. The billionaires gain immensely from a system which is rigged in their favor, and the state must intervene with some kind of redistributive policies. And that's the core of what we are saying. And if you just add to that, let me add two more questions to give you a holistic response. The second is, just look at the tax GDP ratio. I think we are still way below our even BRICS peers. So we are somewhere around 10%. You have South Africa at 18-19%, Brazil at 23-24%, if I remember the figures right. OECD is 32-34%. Obviously, we need to have a much better tax GDP ratio. And the second that I wanted to add is that we need to look at the investments that we make in equalizing policies or actions which can create a more equal society, which is investments in education and health. So if you look at the investments in education and health, really low. On health, let me just say, and I'll stop with that, but on health, public health, our investment is fourth from the bottom in the global list, which is completely unacceptable for an economy of our size with the aspirations we have. You obviously then have such low investments and you have extremely poor health outcomes, which then leads to a more unequal society. So in a way, I'm trying to talk of the building blocks of the new architecture.
And let's focus on health and education for a moment and the possible solutions. So, your own survey says that close to half the parents spend over 20% of their income on education spent or during the lockdown. 39% parents reported being charged hiked fees despite the physical closure of schools and state guidelines restricting fee hikes. And there were fees for uniforms and so on. So, but the fact is that education is a high component of expenditure for families, and that percentage obviously is higher as the income gets less and and parents' affordability is lower. Now, one is to say that we redistribute. What could be the other solutions? That's a specific and a general question. And could those solutions go beyond redistribution?
So you're saying what could be other solutions apart from investing in education and health?
No, I mean, yeah. So one could be investing by the government. Could there be other ways of fixing the gap? And secondly, does all investment need to flow out of a redistribution of wealth is my question.
Okay. So, I would still say education is a right in this country. We have the right to education with us for more than 10 years. And if you look at the compliance of right to education, it is again 12 to 14%. I forget the exact number, but there's several surveys which are saying if you start doing an audit of the Indian schools, only 12 to 14% would be able to comply with the norms of right to education. So I would not want to get into a conversation in a country where education is a right, that we should start looking at alternative resourcing methods. As in, the state has that fundamental primary responsibility that it must provide quality education to everyone. Similarly, health is an aspiration in our directive principle. So I would really find it uncomfortable that we would have resources for bullet trains, but not for primary healthcare. That's the contradiction that we're looking at, and it is ultimately right. Inequality is a policy choice. It is a political choice that we need to recognize.
Right, and your report, which I would obviously suggest and request all those watching this to download and read it in detail, does talk about health inequalities, and it also talks about, also the traditional challenges that Indians have faced in accessing healthcare. But equally, 80% of healthcare in India, Amitabh, is private. And many solutions, like it or not, are being delivered by the private to the extent that they're being delivered. So again, to come back to the kind of solutions that you're offering, which is really, find ways of increasing taxes, either from that 1% additional tax on billionaires' wealth that has increased, or a cess, which the government is talking about, which willy-nilly is perhaps the same thing that you're suggesting. Now, is there a way of improving the quality of private sector intervention apart from, let's say, the government? Because Amitabh, I think the question really I'm also posing in a way is that, is government the best entity to deliver what we want to be delivered or the outcomes that we want?
So, as I hear your question, and this is one of the questions we are all constantly debating. But let me just say that, look at what happened to the private health sector just post-pandemic. I think, the pictures that you had started seeing of people actually dying outside a hospital, a government hospital, because there was no bed. On the other hand, those were the same days when you had private hospitals charging up to 75,000 to 1 lakh. This is something that we have evidence for 1 day of ventilator and ICU, which is unacceptable. So the sector needs much greater regulation. And at this moment, I think it's been very, very clear that the private sector has not been able to deliver what is needed for the general well-being of people. And in that context, to say how can we improve the public services is an absolutely valid question. There's no disagreement that there's a quantum qualitative improvement needed in the public health service, in the public education system. However, to look at alternatives at this juncture, I find it, difficult to accept. Because at the cost of what? As I said, it is just a metaphor that I'm using. So that some people get a bullet train, is that the cost for people's education and people's health? That's something that we need to look at. Within Oxfam, we have started now saying, let's look at a world which has few billionaires but many more nurses. That's the point. Let me just go in, if you allow me. Let me add one more point, because there is a larger context to this also. Because I talked of nurses, so I just remembered. We've been looking at a tax justice network study, which says that every year, $425 billion are lost to different governments because of tax dodging. So that's an additional layer. We were talking of introducing a wealth tax, but on the other hand, we're also appealing how do you ensure greater compliance. So let's reach out to the industry captains, to the corporations, to individuals, that they must pay a fair share of their taxes and not do intentional evasion, which happens across. So, and it happens in multiple forms, from offshoring to direct evasion. So, which will again also strengthen the resources with the state. So that's also something that we need to work on.
Right. And if I can quickly add, from your own report, you have talked about enacting a fundamental right to health for every citizen, and also delivering a people's vaccine that's free and available for all, which of course is what is happening at this point. But whether it remains free beyond a certain number, we don't know at this. So the last point, Amitabh, your report talks about building economically resilient communities. And let me pick on two aspects of that. One is, of course, labor. Migrant labor and the challenges that labor has faced, including the fact that over 100 million people lost jobs during at the peak of lockdown. But of course, most if not all of them have got their jobs back. Though the bigger impact, though at a lower level, seems to be salaried employees, where people have lost jobs, particularly in cities, and more so women. I'm quoting CMI, or the Center for Monitoring Indian Economy data. So your thoughts, Amitabh, broadly, when we talk about building economically resilient communities, what more should we be doing, and how should we be approaching the challenge perhaps a little differently?
Sure. So one, as in you're saying that people have got their jobs back, but there's also this NREGA data, which clearly shows much greater demand on NREGA at this moment compared to last year. So possibly, yes, we are looking at a slow comeback, but there's still many people who've lost their jobs. What is important for us is to both acknowledge and strongly recognize that most of the jobs that were lost were in the informal sector. And I think, that's one of the key areas, again, according to us, for intervention, that we do need to move away. We've been constantly saying that, one, minimum wages need to be constantly revised. But our point is that minimum wages is something which is not adequate for a decent life. What would be critical is to start looking at a living wage. And that's again a fundamental shift. So how do you look at a whole range of interventions, starting from looking at a living wage, to ensuring job security, to ensuring social security? Just look at, few days of the lockdown meant such hardships for that informal sector. People had to, in spite of the police brutally stopping people from going back to their villages, they were still willing to walk 1,000 kilometers just to go back to the security of their villages. There's something very, very wrong the way we have designed our sector. So that would be a very important shift that we certainly must make. And I think that, COVID provides us that opportunity. The only good thing is that we can think of, some of these inequalities. And I love the way the UN Secretary General has talked about it. He says that COVID has been an X-ray. It has just highlighted the huge inequalities that we live with. So let's use that opportunity and reboot in a fundamentally different way.
Right. And last point, which I'll only quote from your report, which I thought was very interesting and timely, is the recognition of unpaid care work at the community level and the need to normalize the redistribution of care work across genders, as well as by providing state support mechanisms such as creches at work sites, access to safe drinking water, sanitation, and cooking gas. Amitabh, we run out of time. Thank you so much for joining me and this fascinating report, which has a lot of research and data. And I would advise, like I said earlier, everyone to read it and digest it and hopefully do something about it. Thank you so much.
Thank you. Thanks.